Vitamin D is one of the most significant vitamins for our general well-being, yet numerous people aren't getting enough of it, especially elderly people. Previous observational studies reported a relationship between lower levels of vitamin D and a greater chance of contracting acute respiratory tract infections. A recent study has discovered a relationship between low vitamin D levels and COVID-19 related deaths in 20 European countries. It is shown that Italy and Spain were two European countries that reported a high number of COVID-19 deaths. This new investigation currently shows that individuals in these two countries present with lower vitamin D levels than other countries in Northern Europe. The researchers state this is mostly in light of the fact that individuals in Southern Europe, the elderly in general, tend to avoid strong sunlight. In Northern Europe, people tend to consume more cod liver oil and vitamin D supplements and tend not to avoid the sun as much. The study did have some limitations, as the number of cases in each country can be attributed to several factors. Furthermore, relationship or correlation does not necessarily mean causation. With this study in mind, let's have a look at some functions that vitamin D has in the body. 1. Vitamin D is required to absorb and use calcium in the body, therefore vitamin D plays a very important role when it comes to bones and teeth. 2. There is an inverse association between vitamin D status and the risk of acute respiratory tract infections, dementia, and depression. 3. Vitamin D helps with the regulation of insulin. 4. When a pregnant woman is vitamin D deficient, it may increase her risk of preeclampsia and preterm birth. 5. Higher vitamin D intake is associated with lower cancer incidence and cancer mortality. How much vitamin D is recommended? According to the United States recommended daily allowance, infants should get 10 micrograms of vitamin D per day. From 1-year-old up to 70 years of age should get 15 micrograms per day, and people older than 70 years should get 20 micrograms per day. Vitamin D options include 1. The sun. 2. Food fortification. 3. Consuming vitamin D foods. 4. Supplements. Food sources of vitamin D include 1. Fatty fish, like tuna, trout, mackerel, sardines, and salmon. 2. Mushrooms, exposed to UV light. 3. Foods fortified with vitamin D, like some dairy products, orange juice, soy milk, and breakfast cereals. 4. Beef liver. 5. Cheddar cheese. 6. Egg yolks.